also accessible by telephone conference call. Notice has been provided to the public through notice at the TJPDC's offices, to the media, website postings, and agenda. The meeting minutes will reflect the nature of the emergency. The meeting was held by electronic communications means and the type of electronic communication means by which the meeting was held. A recording of the meeting will be posted at tjpdc.org within 10 days of the meeting. And with that, I want to welcome everybody. I see a couple more faces. Welcome, Garland. I'm going to ask that Gretchen do a roll call of the people that are present in just a couple of minutes. But I just want to remind folks, if you will mute your computer, just so we don't get a lot of extraneous noise. And I think we agreed last time that if you want to speak, just to let us know, you can raise your hand or put your hand up or something, and we'll try and catch you. And let's see, what else do we need to go over? We only have the one vote today, I believe, for the minutes, and I'll just call those as the in favor of and opposed to and abstentions. So that will be pretty easy. Speakers, public comment will be limited to 3 minutes each. So I think with that, we can just move forward. And Gretchen, would you please give us a roll call so that we can establish a quorum and know who's here?
Sure. The people who I have in this meeting as of this time at 4:03 is Sarah Pennington, Gretchen Thomas, Chip Boyles, Brad Sheffield, B. Lepisto Kirtley, Diantha McKeel, Neil Sherman, Lucas Ames, Becca White, Frank Deviney, Garland Williams, Lloyd Snook, Trevor Henry, Jim Foley, Jody Saunders, Sandy Shackelford, Andy Bowman, Sean Tubbs, Dan Butch, Randy Parker, Jessica Hirsch-Ballering. I don't know who is M. Geisert, and I don't know City Zoom 29.
Paul Oberdorfer.
Paul Oberdorfer, okay.
Okay. So you called out more than just
Yes.
the members.
You
of
have quorum. Yes,
okay.
ma'am.
So we have established that we do have a quorum.
Yes, ma'am.
Oh, that's great. Okay. With that, let's go on and move to matters from the public, because that is next on our agenda. Does anyone have, has anybody signed up to speak, or is there anybody that wants to make public comment from the public, Gretchen? No one?
There's currently no one that has requested it, Diantha.
Okay. Oh, Sarah, there you are. I'm sorry. I recognize your voice. You're so far away, I'm having a hard time seeing you. Okay, thank you, Sarah. All right, then with that, let's move on to our minutes from May the 28th of 2020. And we had one typo that needed to be corrected on page 5 of 5. Are there any comments or any other changes to the minutes?
This is Becca. I submitted some to Sarah, just a clarification, wasn't changing any meaning or anything. But Sarah, were you able to make that change?
Yes, obviously it was after the packet was out, so it will be in the final minute.
Okay, it didn't change the meaning. It's just a little thing.
Yeah, but if we're gonna vote on it, we probably ought to know what the change is.
Sarah, it had to do with my transit update. It said something like our routes are online, and I wanted to clarify that what that meant was we were publishing our route operational status online, not that our routes were online. And so there was a small wording change to clarify that the sentence really meant to say our operating status is posted online, not that our routes are online. So
Okay.
that was a submission.
All right.
I think
Go ahead.
it was on page 3, paragraph 5, second sentence, and the change was all of the routes are online to changing to UTS operating status can be found at the UVA Parking and Transportation webpage. That was the change.
That's what I submitted by email, so.
Great. Okay. And then the only other, the typo that I caught was on 5 of 5, I changed Becca's from Mr. White to Ms. White.
I would call that substantial.
That was a biggie.
Well, I'll take
Sorry
that.
about that.
But
Sorry about that.
My dad, so Ian Malik knows him. He served the County Board of Supervisors in Warren County for many years and City Council in Fairfax City. So I take it as an honor to be mistaken for my very honorable father.
All right. So with that, I will entertain a motion to approve the minutes as amended.
I'll make that motion.
I'll second.
All right, so Lloyd Snook has made the motion, B seconded. All those in favor? Aye.
Aye.
Any opposed? And any abstentions? So the minutes have been approved. Great. All right. At this point, I'm going to turn the agenda over to Jessica. Jessica, you have a presentation for us around the future of transit.
Yes, I do, and I'm going to share my screen.
And I hear it's great, so I'm anxious to see it.
I hope I live up to that. Let's see. All right, can everyone see my screen?
Mhm.
Yep.
Okay. So yes, I'm going to talk about the incredibly large topic of COVID-19 and the future of transit. So there is, hold on one second, because I won't be able to read my slides if I don't change how I'm seeing everybody. Let's see here. Okay. So there is a lot of information out there regarding the impact of COVID-19 on transit systems. Jeanette Sadiq-Khan wrote a piece for The Atlantic. Universities are doing research. The APTA is releasing recommendations. So the purpose of my talk is to summarize all of this information and recommendations being made by public health experts and transit advocates to supply transit agency staff and local decision makers with succinct talking points regarding COVID-19 in transit. If there's time at the end, to inspire discussion about local efforts to combat disease transmission and assure the public that transit is safe, and identify additional opportunities for local transit agencies to collaborate in the near and long term. So a quick outline. I have 3 main topics to discuss. The first is that transit is an essential service during a pandemic. Next, that it's talking about ensuring the safety of transit users and operators during the pandemic. And finally, planning a post-pandemic future for transit. So for each of those topics, I have a quote to start us off. So this is our first topic and our first quote. And it was said by Jeanette Sadiq-Khan and Seth Solomanow in the Atlantic article that appeared on June 14th. So even during a pandemic, public transit systems show themselves to be indispensable, transporting essential workers to jobs while also acting as a major engine of economic stability and equity. Okay, so transit operations during COVID-19 have highlighted transit's essential role and its inherent value. Most importantly, transit serves essential workers. Transit is how hospital staff, pharmacists, grocery store, and hardware store workers get to work. Nationally, 2.8 million workers in essential industries commute by transit. That means that 36% of, or essential workers make up 36% of all transit users nationally. Large medical centers, think about the UVA Medical Center, rely on transit to address serious parking concerns. And essential workers count on transit. Limiting transit service can cause significant stress to essential workers already taking on a significant disease risk burden and working longer hours. Also, transit ensures all community members have access to disease testing and ongoing health care. Basically, the same people who relied on transit before the pandemic are going to continue to rely on it through the pandemic. Trudy Henson, the Public Health Program Director at University of Maryland Center for Health and Homeland Security, said some transit or closing or suspending transportation can make it difficult for people to get proper medical attention, which can actually increase the spread of a virus. Now, knowing that people are going to use transit to get to healthcare, we need to remember that some transit users are going to be sick. That's how it's supposed to work. And finally, reducing service can make it difficult to maintain proper physical distancing. And that's especially important when we recognize that some transit users will be using transit to get to disease testing and healthcare. Now, especially people outside of this room often think about transit as more of an urban amenity, but transit is an essential service in rural communities as well. Nationally, 1 million households in predominantly rural counties do not have access to a vehicle. And the majority of counties with high rates of zero-car households are rural. It's also important to note that rural populations may have a cascade of risk factors during the pandemic. They might have reduced access to information because of limited internet access. They're already at a greater distance from health facilities. Other problems like that compound on each other. All right, so despite transit being super important and essential through the pandemic, transit ridership is at record lows. Nationally, transit ridership decreased by 73% and fare revenue decreased by 86% in April 2020 versus April 2019. So in areas like Richmond and Petersburg area transit in Virginia, places that are buses, they had about 40% ridership decreases, whereas commuter trains had the largest decreases nationally. Chicago's Metra and San Francisco's BART had a 97% decrease in ridership. You could note that commuter train riders have statistically higher median incomes than bus riders, so there might be more choice riders on those commuter trains, which might account for some of that difference. But even with this record low transit ridership, it needs to be put in the context of overall reduced movement, which can be evidenced by VMT reductions. So nationally, there's been a 39% reduction in vehicle miles traveled. If you look at particular urban areas, many of those urban areas have an even more drastic reduction. So Arlington had an 85% reduction in total VMT. That was comparing April 2020 to January of this year. Alexandria had an 86% reduction and DC had an 88% reduction. Now, these numbers came from an analysis of streetlight data. So I had one of our other transportation planners in here, here at the TJPDC do our own analysis for Albemarle County. I don't have like the percentages, but what you can see is the dashed gray line is the average VMT for January 2020. And then you can see day by day, or really every other day by day, the daily VMT in Albemarle County. And you can see the state of emergency was declared on March 13th, and you can see that there was plenty of traffic before then. And then after the state of emergency begins, there is a precipitous drop-off that continues to be low for a really long time, and only now in June is starting to creep back up. Okay, so transit ridership has decreased because of an overall reduction in travel. There's been inter and intracity travel reduced because of stay-at-home orders and other restrictions, shifts to telework, increases in unemployment, and other behavior change. So we expect to see low transit ridership because people aren't going anywhere. But we also have to recognize that there is a fear of transit in particular. So another quote from that same Atlantic article: "The assumption that transit was accelerating infections stoked public fears and quickly hardened into conventional wisdom." So now a little bit of respiratory disease basics, just in case you're not aware. So respiratory disease is transmitted primarily in 3 ways: large droplets, aerosols, and fomites. So large droplets come from sneezing, coughing, talking, breathing. If you've ever seen a picture of a sneeze, the large droplets are all those lovely drops of sneeze that you can see in the high quality picture. These large droplets carry plenty of viral particles, but the nice thing is that they drop quickly. The belief that COVID-19 spreads through large droplets accounts for the recommendation that you stay 6 feet apart, because 6 feet is enough distance for those large droplets to fall and not infect another person. Aerosols also come from sneezing, coughing, talking, and breathing, but they're much, much smaller than droplets. The problem with them being smaller is it means they don't drop so quickly and they can linger in the air. So depending on the size of the virus, that determines how quickly the aerosols will fall. So for COVID-19, the best estimate of how long these aerosols linger in the air is about 3 hours. And then finally, there's fomites. Large droplets and aerosols can land on surfaces, or an infected individual can cough in their hand, touch a doorknob, and disperse the droplets and aerosols that way, resulting in indirect disease transmission. So how do we stop transmission? So avoid close contact settings. You don't want to be, sitting up next to someone and having a chat with them. That is, if you avoid those kinds of settings, you can avoid the problems with, you can avoid catching the virus from those heavy droplets. Avoid closed spaces and avoid crowded places to avoid those aerosols. Mask use can be helpful depending on the type of mask. It either protects the wearer or it protects people from the wearer. And regular cleaning and disinfecting addresses the fomite issue. Okay, so let's see. In summary, my next few slides are going to conclude with current research suggests transit is no more dangerous than any other indoor space. But backing up a little bit, in late April, an economist at MIT released a working paper titled "The Subways Seeded the Massive Coronavirus Epidemic in New York City." At the same time, initial recommendations were released by the CDC, suggesting that employers encourage employees who typically use transit to drive alone instead. So at the time these recommendations and this paper were released, there was just a lot of fear about the virus, and there was a lot of fear about transit in particular. And because the virus seemed to be worst in New York City, people linked the spread of the virus to transit. But it's important to note that there are numerous issues with the analysis by Harris. He's the economist at MIT. And I won't summarize those numerous issues. If you are truly interested, there's some great public health research papers out there that can explain it much better than I can at this time. And also the kind of gold standard work that's been done to actually quantify the subway's impact on other respiratory disease spread. And one of the most famous ones was done with H1N1 in 2009. That gold standard work uses viral transmission models. So that kind of work can't be done yet because COVID-19 is new and we don't have accurate viral transmission models. So if you want real research, we don't have a clear answer of whether or not the implication Harris made that transit was a big problem in the coronavirus epidemic. We just don't have solid research to tell us either way whether or not that's true. However, we have some really great anecdotal evidence that suggests that transit is not the problem, or it's not a big problem. So other countries with heavy transit use and high levels of contact tracing are not finding case clusters attributed to public transit. So for example, Hong Kong, pre-COVID, Hong Kong's public transit carried 12.9 million people per day, and transit use hasn't fallen as drastically there as it has in other places. Even so, with all of those people crammed together on transit, they've only had 1,100 COVID cases as of June 14th. For another example, in France, between May 9th and June 3rd, so almost a month, French officials found 150 clusters of COVID cases, but none of them were traced to public transit. Similarly, no clusters have been traced to transit in Japan, which also has a lot of transit use. Now, I'll add one caveat. It may be difficult to trace clusters to transit. The reason for that is that we are on transit for a much shorter amount of time than we are at the places that transit takes us to. So it's a lot easier to trace a case back to an exposure at a workplace where you know your coworkers and you're there for 8 hours versus tracing a case back to an exposure on a bus where you were only with the exposure for 2 stops. Okay, so the same reasons that it might be hard to trace a case back to transit are the same reasons that transit might just not be causing disease transmission in the first place. So Conditions that might contribute to limited disease transmission on transit include the short time we spend on transit compared to the places transit takes us, the fact that there's some air circulation through frequent door openings, and the fact that there's limited talking. So transit is not a place where people tend to get very chatty, and that's a good thing in this case because it means that people are not producing those heavy droplets or aerosols that can spread the disease. Okay, so I haven't talked very much about operators. I've talked a lot about passengers, and that's just because thinking about operators and disease transmission opened up a whole new set of articles that I didn't have time to really dive into. But there were two important points that I wanted to share. So the high rates of infection and death among transit operators might be evidence of a high risk of viral exposure prior to implementation of any safety measures. So thinking about New York City, there was community spread of COVID-19 before transit made a lot of changes. I think in the subway in particular, transit operators were not allowed to wear masks, even as community spread was happening. There was community spread even before they transitioned to rear door boarding. There was a lot going on in New York City in particular that is different than how we might operate transit now. So there's a lot to be learned from rates of infection among transit operators following the implementation of safety procedures. And a quote I just really liked: the work of transit operators should be considered sacred, not sacrificial. The work they do is important, it's essential. It should be respected, but we shouldn't expect them to take on a higher disease burden just by doing their jobs. Okay, so immediate recommendations for transit agencies. There are a ton of recommendations out there. What I did was dive really deeply into recommendations by the American Public Transportation Association, which had very specific and very detailed recommendations. NACTO, the National Association of City Transportation Officials, had less specific and more big picture recommendations, and CityLab, which is kind of a popular press set of recommendations. And I included that because that's what people who are reading about transit but aren't like part of transit agencies are hearing when they are hearing about what transit agencies should be doing. And those common recommendations that were common to all of those are on the right-hand side. Staff should wear PPE and passengers should wear masks. Action should be taken to increase physical distancing, like rear door boarding and maintaining service schedules so there's enough space on every vehicle, and use barriers to physically separate vehicle operators from passengers. It's recommended that there's frequent cleaning and reduction of high-touch services, for instance, eliminating fare collection. There should be protocols established for staff exposed to COVID-19 or showing symptoms. And finally, pandemic safety education for passengers and increased and improved communication. A lot of the problems that transit is going to be facing through the pandemic are ones of perception. So education and communication can combat those perception issues. Okay, historically, this is a quote from Alan Levy and Eric Goldwyn from How U.S. Public Transit Can Survive Coronavirus. Historically, it has been during times of crisis that agencies have deferred maintenance, cut service, and canceled expansion projects. It's these choices that have crippled American transit agencies before. Okay, so let's take some lessons from the 2008 recession. So right now, transit agencies are losing revenue due to reduced ridership, increased cleaning costs, diminished local taxes, other impacts from a contracting economy. Back in 2008, with the recession, transit agencies were facing a lot of the same revenue losses, with the exception of increased cleaning costs. Facing revenue losses in 2008, transit agencies typically cut service and limited large projects, and that correlated to dramatic ridership loss. As a counterexample, Seattle Transit notably increased service and projects and saw an increased ridership. So what projects should transit agencies focus on during COVID-19? Broadly, focus operations on serving community needs and support other COVID relief efforts. Specifically, that means make strategic reductions in service. Try to reallocate staff and vehicles to focus on routes that serve essential workers going to hospitals and medical centers, and as well as grocery stores and hardware stores, while maintaining enough service to permit social distancing on board the bus, no matter the route. Creatively support priority populations. So some examples of how transit agencies have done this is some transit agencies have used their vehicles to deliver Meals on Wheels. Others have used their vehicles to make Wi-Fi hotspots for places that lack internet access. Finally, explore alternatives for transit-dependent communities. As an example, Detroit created a program for a $2 on-demand ride to COVID testing centers. Additionally, continue with necessary and planned maintenance. This might give an opportunity to reallocate staff and thus prevent layoffs. And it also just continues the forward momentum that transit agencies have had in the last few years. Okay, so how might COVID-19 impact long-term transit planning? There's been an early assumption that decreases in ridership are most pronounced where there's a high proportion of choice riders. I kept reading this in the articles over and over again, that commuter trains have all these choice riders. People who take commuter trains are wealthier statistically, and they have the choice to ride or not ride. But a question I want to pose is, what if the impact is less from making the choice not to ride transit, but more so just a transition to telework, eliminating commute trips? The same kinds of people who ride commuter trains and have higher incomes also tend to have the kinds of jobs that transition very easily to telework. Will telework and other measures to reduce COVID spread, like staggered work hours, become permanent after the pandemic? And if so, are we looking at a paradigm shift for transit planning away from the commute trip and a focus on new ridership populations? So in summary, transit serves essential workers and is vital to the continued health, safety, and economic vitality of both urban and rural communities. Transit is perceived as a dangerous vector of disease transmission, but research and the experiences of other transit-dependent cities and nations show that high levels of transit use can safely continue throughout this pandemic, provided certain precautions are taken by agencies and individuals. And the future of transit hinges on the decisions made right now. Budget-saving cuts must be strategic, and plans must be in place to prevent those cuts from becoming permanent. Transit agencies and their communities should creatively envision how transit might make communities healthier and more resilient now and in a future new normal. And then I will make sure this is available on our website. There's a lot of references. These are just the articles that are directly referenced in this presentation. All right, that's it.
Thank you, Jessica. That was really interesting. Let's open it up. Does anybody have, it would be interesting to hear Brad and Garland and maybe Becca just thoughts on this, as well as maybe some of the rest of you have questions or comments. Who wants to start? Brad? You want to make
sure. Yeah, I'll start.
What? Yeah.
I think, transit is going to need to look at how it serves the population, very similar to somehow some of the ways that businesses will be looking at this. No matter what steps we take to keep the vehicles clean and take the protective preventive measures with our staff and drivers and so forth, and all of that, until that, quote unquote, consumer confidence is strong enough, all of that won't matter much. And so it starts to come into more of a communication and just repeatedly getting that information out there, so that when that rider who used to ride one of our services starts to think about riding again, they're looking for it and they're reassured at that time. So I think it's important to know that we could put all the plans we want in place to be cautious and keep things clean, but it has to connect with that consumer in order for us to regain that ridership.
Garland, you took you unmuted yourself, so I figured you were ready.
I was just preparing just in case. So a lot of information was given by Jessica. So from the local, and I guess larger transit agencies have a little more ability to be selective, because they have a lot more operators to make changes to their service levels. As a smaller transit agency, it becomes really difficult to do that. And also protect and trying to get the barriers in. There are a lot of things smaller transit agencies or all of the transit agencies kind of got caught behind the wheel, so to speak, because we were really trying to get the PPE, the mask, the gloves, that sort of stuff. The protective barriers are coming, right? So we are in that process of purchasing them. We've put in a protective shield right now. It looks similar to a shower curtain, but it's thicker. It's designed to put in another layer of protection. But those additional permanent barriers are an additional product. That still doesn't have anything to, still doesn't make it 100% safe. So there's a lot of things that a lot of transit agencies, and we're one of them, that are exploring how to, clean the air. That's another component, because, it's 3 hours that, the smaller particulates can stay in there. So we've issued Lysol to all of our drivers as a small thing to try to, in case somebody sneezes or coughs on the vehicle, so they feel safer and they can clean the air themselves quicker. But we're looking at, ionized lights that we can put into on our HVAC systems, all those sorts of things. Transit's kind of really figuring out what are the next products to help us keep our vehicles safe and clean. We're putting in all the measures we can to clean as much as we possibly can. We've hired, some of us have hired professional cleaners to do certain things on the weekends. So we're trying to do everything we can. There are also another steps that, we're getting from our cues from the feds and the state about, our service levels and how many people we can carry on our vehicles. So there's a lot of things that we're trying to navigate right now, and we're all in this together. We're, it's a salad that keeps changing up on us every single hour. I wouldn't say every single day, it keeps changing every single hour on us. So we're trying to do everything we can to stay proactive in front of it. But this is one of those areas where we're trying to start planning for what the system looks like a year from now. We're trying to also really figure out how to weather this storm for the next year. Because, you have a staff that you want to keep. If you lose them, it's going to take you a long time to get them back and get your service levels back up. So there's a lot of competing elements that we're trying to figure out and deliver a service level to the communities that we're in. So I'll just stop there and just say, we're all trying to figure out what's the best mix right now.
Becca?
Well, thank you to Jessica, and thank you to Brad and Garland for detailing all those things out. Of trying to figure out what I could add to that, and I can offer that the expectation of telework being a permanent thing is, if the UVA as an employer is any indication, I do think that is going to redefine that work trip and that focus on the work trip, and then transit becomes much more about, well, can I not have a car, and can I be, can I survive without and thrive without a car as much as it before. We were very interested in that work trip, and I think that as a colleagues are finding out at UVA that this work from home thing can work, and it changes everything. So I would add that as one of 10,000 employees at UVA that are successfully working from home, as you can see here. Number one, and number two, just the difficulty of being nimble. Garland referenced it a little bit in terms of how to be responsive quickly, and that's really, really difficult for a publicly funded transit. It's really difficult for non-publicly funded transit to put everything in place to rearrange your bus routes to serve the new demand that's out there. And I know Neil's working on new guidance for passenger loads and that sort of thing. But and there's guidance out there about only taking essential trips on transit. And, these are guidances that has been out there already, limiting the number of passengers. That physical distancing is going to be with us for a year probably or more. So even despite what phase we're in with the governor's recovery and all that stuff. So I guess those are the two things I'd add to what Jessica and Brad and Garland said so well.
Okay, thanks. Anybody else? Questions, comments, thoughts?
I'll just add one other thing before we kind of move on, is that one of the bullet points in the presentation was getting our riders to use masks, face masks. That's kind of, it's some want to do it. I know the governor has put it out as an executive order, but the enforcement is the health department. It's not the police department. So we're offering them, but we've got some folks who will not put them on. They don't feel they have to, so they're not putting them on. But we're making it available to everyone. We're educating them about the effects of stopping the spread by using those face masks. But we have some who just will not do it, and unfortunately, we've had a few incidents where we've actually had to call the police to help resolve some issues on our vehicles because individuals became a little, belligerent on our buses, saying that they're not going to use it. So, there are things that we're, and we appreciate. I appreciate the time my operators do. The governor's executive order asking folks to use face coverings on public transit. But the exceptions where you can say, you have a medical condition that you don't have to use it, and we can't verify it, kind of leaves that back door open. But we're doing everything we can to try to prevent the spread as much as we can.
Yeah. Jim, did you have anything you wanted to add? I saw you pop up on the screen.
Yeah, our business is a little different. Garland and I share a student population, but we're looking at how many students we can put on a bus. CDC in the state said student every other seat. I think we're going to go with a student in every seat, so that will have less of an impact on our bell schedule. And I think other counties are looking at that across the state. I know Virginia Beach and Chesterfield are going to go that way too. So, yeah, and some of the things we'd like to do, like the shower curtain thing, the state won't approve that because of flammability and, vision impairment. So we're just going to have, all our drivers are going to have to wear masks, and we're going to require the students to wear them too. And if they don't, they're not going to ride the bus. So the parent would either have to bring them or they could learn remotely. But that's what we've been working on.
Yeah, we were on a call this morning.
Yeah, Garland and I spend a lot of quality time together now.
Yes,
Well,
we do.
It is interesting because certainly what we're seeing in the county is less need for office space because more people are going to be working from home. So it does get to what Jessica was saying is some of the ridership is going to go down just because people aren't going to need to be riding as much, I think, in the future. And that's something that we have to figure out. Very quickly and selfishly, I'm going to ask, Jessica, would you send me your presentation? I have a Virginia Transit Association board meeting tomorrow, and a couple of those slides I'd like to reference if you
Absolutely.
don't. So thank you. B, did you have something you want to say?
Yes, I was just wondering whether or not, because Jim and Garland both said that, Jim, you said the students would have to wear the mask. Garland, you said some people don't want to wear the mask. I've noticed in some stores, is there any way that we can just make it mandatory, i.e. you don't want to wear the mask, you don't get on the bus?
Yeah, so we're my situation's a little different with students. Garland has students too, but so I guess what we do is if the parent was there or if they were an older kid, we just wouldn't let them on the bus. if they're a younger kid and there's no parent there with them, we'd probably take them to school, try to isolate them on the bus. It may impact other kids that are riding, so we might have to get a bus to come back and pick the other kids up. And then once they got to school, we'd have to let the administrator know, and then they would contact the parent. But to protect our drivers, that's what we're going to have to do.
Yeah, I mean, really, the state is saying that we only can carry 12. Most systems are asking for the exception, so you can carry one child per seat, which gets you up to 24. Think about it, if you had 600 kids and you only can do 12 kids, how long it's going to take you to get all the kids in the school every morning.
No, I'm aware of that, and I'm very aware of the limitations on the schools and everything, but
Yeah.
I guess what I was talking about is, why can't it be mandatory, since it's public transportation and you don't have to ride the bus, for adults to wear a mask?
So the exec, and Neil, you may want to help me out on this one a little bit, but it's the executive order for public transportation that basically spells out that the governor is saying that you should wear a mask while wearing public transportation. But in that executive order, there are like 5 exceptions to that. And one of those 5, you could just basically say that I have a phobia of wearing a mask, or I have a health condition. And it also says I can't check your health condition. So therefore, all you got to say is I got a health issue. I can't wear a mask.
Okay, thank you.
There's nothing that would prevent me from to get
Understood. I didn't know that. Okay, thank
Yeah, I didn't either. Yeah.
We tried. No, but we're not. We would prefer not to advertise that component of it, but we want to make sure we are still educating everybody we can, and we are passing out masks. So every morning, our drivers leave with between 5 and 10 individually bagged masks to hand out to individuals. If they run out, we have a supervisor that will actually take them. So we're doing everything we can to try to encourage people to use it, but some still won't do it.
And I'm looking at our time. I'm our official timekeeper here. So if there are any other comments or questions that anybody has. Well, that was really interesting, Jessica. Thank you very much. I know we all appreciated it. All right. We're moving on to the joint marketing and public relations effort, which Sarah, I think, is presenting.
So this is really just reopening the discussion. It has come up a few times about looking at joint marketing and public relation efforts for all of the systems together. It is actually in our strategic plan that SIR did, goodness, 2 years ago. That was 2 years ago. Wow. So it's one of those things that's been discussed a few times, but we haven't really got off the ground and running with this. So Chip and I thought it might be a good time to revisit this, to confirm that this is something that RTP thinks has value, and to begin convening all of the service providers to start looking at how we can use resources that are scarce these days to be the most effective in letting people know all the different ways to get around in the region. I think that's kind of the key component, is there's so many pieces and different services work better for different areas. And so having a one-stop shop for information and marketing to kind of help combine all of the services and make it more clear for people to know what they have as options and what they can use.
So throwing that out then, thoughts? I think I've already seen Brad and Garland. So John and Kat have already, it's not getting at exactly the same thing, but you all have been sharing some marketing around the safety of your systems.
Yes.
Yeah,
So
and
we did a joint PSA. It's actually a commercial that's running now. It's a 30-second commercial. that encourages individuals to use face coverings. So that's going well.
Any thoughts about what Sarah's referencing? It would seem like to me, it would make perfect sense to have some sort of a joint marketing effort with the providers in the area. Thoughts where you might want to go with it?
This is Becca, just to jump in, but yes, we're interested in that, and I'm thankful to Garland. He already has reached out to us on joining this joint message that is so easy to rally around, and then we can build on that to for less urgent messaging. But UTS is all in.
So I guess, Chip, would this be something that we could look at a committee around? I mean, I hate to be another committee, but I'm just trying to think about how to get at this. What are your suggestions?
Mine would be on more of a technical committee of having staff people begin working on it, because I see it as two opportunities now when of course, when this was selected in the strategic plan, there was no COVID. So we weren't thinking from an emergency standpoint, but now I think we can look at an immediate type of partnership where we can start to brand a message for now, but also for the longer term future. And I think this would start building the base for it. But most of the transit operators, we're already getting together for different tasks. I think the easiest thing to do is just tack this onto that, and perhaps get a couple other people. I know Jody, who's new to Jaunt, and anybody that Garland and Becca has, and just add them to the conversation.
Okay, seems like there's agreement about that then. Hearing no objections? Yep. All right. Well, that's a great segue into Brad. I think you were going to introduce your new Jaunt staff member.
Most of y'all have met Jody before in many of her roles in the community with communications and public relations. But guess on June 15th, Jody has officially joined Jaunt full-time as our Director of Public Relations. So she'll be tackling quite a bit of our communications that has been discussed here and many other settings. So she was an outstanding candidate, and I've worked with her before in other settings and was happy that she had applied. So I imagine she'll be joining in on the RTP meetings just so she can be kept aware on just things going on from a regional standpoint. But she definitely will be working with a lot of y'all on a lot of the communications and marketing that we'll be moving forward with.
Great. Jody, are you there?
Yeah, hi, I'm here. I'm lurking. I wasn't expecting to be introduced, so hi.
Welcome. Can you share your video, or are you on the phone? Maybe you're. There she comes.
Hello.
We're going to push the envelope here, Jody. Well, welcome.
Whatever you want, Diana.
We're glad to have you.
Hi, Sean.
All right. I guess with that, then we have committee updates. And the first one, I think, is the Budget Technical Committee. Chip, are you going to take that one?
I certainly will, but yes. What I can let everyone know, is part of a process that began, a year and a half ago. We had an RTP committee that helped to develop a memorandum of understanding between Albemarle County and City of Charlottesville for CAT services within Albemarle County. What we've begun to do now as a function of the RTP is to assist both City of Charlottesville, Albemarle County, and CAT to continue to monitor that funding agreement and begin to hold quarterly reviews. Normally, the budgets do not change a whole lot between when they're developed The grants are awarded, you know what the revenue sources are, and then the expenses remain usually fairly confident. Not trying to speak for the transit operators or Garland, but unless fuel just really skyrockets or drops or petroleum-based products change a lot, usually the expenses remain fairly constant. That is not the case anymore. FY20 and FY21 will be quite different than what it looked like. So beginning in early July, we have a technical committee of CAT, the city of Charlottesville, and Albemarle County that includes some of the financial staff, administrative staff, and then the transit operators that will begin to look at this on a quarterly basis. And we'll be able, with the RTP staff people, to review any changes that have occurred, such as CARES Act funding that came in, and be able to just provide a report to the city council and board of supervisors on a quarterly basis of those changes. So we've got a meeting scheduled that will kick this off, and I believe right now we're shooting for July 9th is the date.
For your first meeting.
Yeah, this is the kickoff meeting, so that what it'll be set up is that, so after the end of the fiscal year, June 30th, it normally takes 30 days to a little bit more for all of the financial transactions to come in. And so that should give enough time to start reviewing, you know, what the actuals were for the last quarter of FY20. So this will be the kickoff meeting, but the next meeting will very likely be, you know, after those financials are in.
And just for Albemarle County, for Trevor and B especially, this gets at what we talked about, I think, in our budget meetings about getting quarterly updates around transit and CAT. I think that's what.
This is, yes.
Yes.
Yes, ma'am, I believe it is. And
Yeah.
For Albemarle County, it's Andy Bowman and myself will be on that technical staff.
Great. And then that report will come back to the Board of Supervisors and go to City Council as well. So, yeah. Okay. Any comments or questions? Okay. All right. So then the next committee is the Equitable Driver Appreciation Committee, and that's Jessica. You're going to report out?
Yeah, so I'll just be brief, and I'll talk about both committees at once, basically.
Okay.
So on June 16th, we had a meeting of both the reporting subcommittee and the Equitable Driver Appreciation Subcommittee. We talked about purpose for both of the committees and how we wanted to move forward. We set a few next steps. And one of the other things that came out of that meeting is that TJPDC had completed a task put on our to-do list from a previous meeting to create a shared folder system for all the subcommittees. We've done that. People are already starting to use those shared folders to share things and comment on things. So that seems to be a success so far. Another thing that came up during both of those meetings was a lot of conversation about COVID-19, and we decided to add yet another subcommittee. I'm not sure how often we'll meet, but we'll definitely use the shared folder to share resources. Basically just giving people the opportunity to connect and share ideas and share frustrations as we continue through things. Were there any, I can answer any specific questions or comments.
Any questions about the Equitable Driver Appreciation Committee or the Reporting Committee? Questions? Everybody's good? I think at some point the idea is that there will be specific action items coming from these committees that will come back to the entire board.
Yeah, and one other thing I should have mentioned, because it's kind of an exciting thing, one of the first things that the reporting committee is going to work on is creating, pulling together all of the agency's information about routes and putting together, overlaying them on a GIS map to create one map for all of the transit routes. And that'll be a good starting point to identify relationships between the routes and begin the conversation for how the reporting committee wants to move forward. So that should be something that we should have. I know people have already shared a lot of information with me, and that's something we should have in a few months.
Well, I know we talked about that at the Driver Appreciation Committee as well, was looking at interactive maps so we could see where the routes were going, where they were overlapping. And that was not only for the, for CAT and Jaunt, but for the school systems as well. That was as well. So, yeah. All right. Any comments or questions? All right. Then the next one is a very easy one. According to our bylaws, I need to appoint a nominating committee for the 21 officers for a July vote. And Lloyd Snook and B. Lupisto Kirtley have graciously agreed to be that nominating committee. So I have no slate right now to mention. We just have the nominating committee, and we thank you for volunteering your time. And we'll be hearing more about that in July. And I can't see Lloyd. Well, there he is. He just.
I'm here.
Thank you, Lloyd. Thank you, B.
Happy to help.
That was easy. So
Never let it be said I didn't do the least I could do.
I did all that.
So the next agenda item are the staff reports. So Chip, you're going to give us a Virginia Breeze Danville to DC update?
Yes, I'll talk about that. And Afton Express, there's really not a whole lot because of things have slowed down a little bit. Neil may be able to provide some updates that I haven't heard about because most of what I've heard has just been a slowdown in both of those processes. The Virginia Breeze, I think I reported earlier that an affiliate of Megabus or Megabus has won the award with the state to provide that service. But I haven't heard any updates as to when that will actually begin and as well as where the actual stop will be. I think I reported earlier that their last look was up on 29 because of the time it takes to bring a bus into downtown and get back out. It messes up their schedule trying to get to DC and away from DC. So that's about all that I've got on that. Afton Express, very similar. They've done a lot of work and have put together what their logo will be and their marketing campaign. But they are waiting for the official award from the state. And most of what I've heard, and again, Neil, please correct me on this, is that a number of those awards will be delayed. They're usually awarded so that they can be implemented beginning July 1st, but many of those may be delayed until earlier into the fall.
Yeah, I can give you an update on both of those. And actually the contractor for the Virginia Breeze is Dillon, the bus company who operates a lot of the Megabus, and they actually were in Charlottesville today reviewing the stop and times, and so they are probably very close to putting the final schedule together. We are looking for this particular route to start in August. We have a marketing company that will probably, after we finish things next week, as far as times and fares and things of that sort, we'll start doing marketing, and then the website will open up for reservations. I don't think that the actual reservations system will open up until about 10 to 14 days before the service begins. We are starting with our first existing route, which was from Blacksburg to Union Station. That's going to start later in July, and then the other two routes will start in August. And so I think early next week we will probably have all the times situated and all the locations. And Chip, you probably are correct where the stop is headed to be, but I know that, like I said, they were in Charlottesville this afternoon with a bus. So some people may have seen a bus in the town to do some testing, turnarounds, and things of that sort. So, but we are sort of excited. The website will be talking about how much seating will be available with the pandemic and things of that sort. And as far as the Afton Express, it is correct that most of our projects for public transportation will not be out in the, but the Commonwealth Transportation Board will not approve the projects probably not until September, and then there will be 30 days public meetings and public drafts, so they would be approved in October. And so that is about as much as we can talk about that, because obviously some of these things are changing rapidly, but hopefully, you know, that's hopefully the latest that we'll know when Transportation Board will approve projects. And we're hoping that it'll be at the September Transportation Board meeting.
So it sounds like to me that Afton Express, we're probably looking at November.
Well, yeah, you may be looking
Yeah.
later than that. I would think.
Okay.
I don't know.
The earliest would be November.
Yeah, I would think so.
Okay.
You know, it's not what we, you know, yeah.
Yeah. Okay.
I mean, I think November will be kind of they'll get a notice, but
Right.
there's still a lot of administrative work.
Right. Right.
You're talking on into next year before you'd start.
Right.
All
Most
right.
likely.
So we're talking first of the year or past. Okay. I was being ambitious. Sorry.
That's fine.
Okay. Any comments or questions on those two services? All right. The next item that we have is our 21 meeting calendar to discuss. And Sarah put a copy in your packet. What jumped out, a couple of things to just kick off the conversation. I noticed that July the 23rd, historically no meeting. The reason for that was because in July, the last couple of Julys, the city took the month of July off. And because the city wasn't around to participate, we canceled the July meeting. I'm not sure we need to do that now, to be honest with you. And I'm just asking Nikaya and Lloyd and Garland and whomever from the city, would it work for you all to go on and schedule a July meeting this year? Or does everybody, is there a concern, or do you want to cancel the meeting?
Well, I am supposed to be probably on the last day of a vacation on the 23rd. I could Zoom in, I suppose. Or we may end up coming back a day early, who knows? But it's just a condo overlooking the golf course, and we'll see whether my bad shoulder lets me still be playing golf on the last day of the vacation.
But I don't think the city this year is because really, for the most part, the last couple of years, the city shut down for July, and that was historically the time they took off. Nikaya, you can jump in here if you want, but that's not going to happen this year, I don't think.
It's earlier in the month versus the second meeting of the month this year. But I do have a kid birthday that day, so I probably will not be able to make it on the 23rd.
So I guess that leaves us with, if we don't have anyone from the city at the meeting, we can't vote or do anything. So if there is a possibility that Lloyd and Nikaya are both going to miss this meeting, then I guess I would suggest we not have the meeting, because I don't want to end up in a meeting where we can't vote on anything or take any actions.
If there is a need to have the meeting, I will make myself available. If there is not a need to have the meeting, I would just as soon not.
All right, I'm going to throw that out to the group. You all, thoughts from you all? Would you like to just cancel July? It's up to you.
Diantha, isn't it just a workshop meeting anyway? It's not a business meeting, so we wouldn't be voting anyway.
That's right.
So maybe we could have a workshop on something that may not be as germane to the city as something else, as maybe other workshop topics might be.
Yeah, that's fine. We could do that. That we have had some interest in Brad and Karen presenting to us their on-demand model. That would probably be on the agenda. It may be, I don't know if the city would be interested in hearing that. I mean, so I guess I'm just, what are your all's thoughts? Would you rather take a pass on July or go on and schedule a meeting in July?
So Garland, would you be available in July? I'm happy to have you acquire the information for the rest of us.
So July 23rd, I'm just looking at the calendar. My, all right, so my birthday is actually the 25th.
Oh, happy
So,
birthday.
thank you.
Writing that down.
39.
He had to look at the calendar to figure out when his birthday was.
I had to look at it to make sure it wasn't, it's a Saturday, which I thought it was, but I was trying to take off a few days that week. So I don't know if I'm going to.
Okay, well then let's do this. I'm just gonna make a decision. Let's just cancel July and we'll go back to the next month. Is that okay, August? Because
Sounds good to me.
it sounds like July has enough people going. And we'll move that on demand to August. So the July meeting will be canceled if that works. Now, what I would prefer not to do, if you notice the list, it says November, December, and January, we would not have meetings. If you looked at the holidays, last year, we split the difference between November and December and had a meeting in early December, which would be if you looked at the calendar last year, Thursday, December the 10th. We would cancel the November meeting and then have the December meeting early on December the 10th. That would be one thing to consider and perhaps my recommendation, rather than canceling both November and December. And December the 10th gets it away from Christmas enough that most people can make a meeting. Any thoughts?
Makes sense to me.
Diantha, could we do the 17th?
Sure. What, the 17th? Uh-huh. The 10th, this doesn't work. Yeah. I was just looking at last year's calendar, to be perfectly honest with you. I'm happy to adjust it. Sure.
Would the 17th work?
Yeah, I'm just trying to get one in between those 2 months, you know? Sure, the 17th is fine. You want it, any other?
Works for me too, just the 10th is going to be a challenge.
Okay, then if everybody is agreeable, let's say December the 17th.
Yeah, I can't do it December 17th. I have another meeting scheduled.
Okay, all right. Okay, well, why don't we do this? Why don't I ask Sarah to send out, we'll pick some dates and we'll send out a doodle poll.
Yeah, I will say I might be able to attend a part of the meeting.
Well, we can send out a doodle poll and see what day works. We'll pick a couple of dates in December. What we can agree to today perhaps then is to have a meeting earlier in December to get away from the Christmas holiday. And we'll send out a doodle poll, see if we can find another date. And then January, historically, no meeting, which is it. I thought we met last year, but I guess perhaps we didn't.
We did not last January.
I'm sorry?
We met. No, we had no January meeting last year.
Okay. And
Or
I think that's
because everybody was reconvening and doing all of their things, I guess, Sarah.
Correct.
It's usually committee assignments
Right.
from a new council, which won't be the case this time, I don't think.
Well, so I'm opening up again for your all's thoughts. We could cancel the January meeting. If we do that, it's especially important probably to have a meeting at least between November and December. Thoughts? Or would you prefer, I mean, I'm throwing a lot of things out here because I'm trying to make it as easy for you as possible. We could meet in January on the 28th and go on and cancel the November and December. Maybe that's easier. But I don't think we want 3 months without a meeting.
I'm not familiar enough with the workflow of the organization to know whether it matters November, December, January. Is there something in particular we have to be doing during those months?
Chip?
No, nothing in particular. I think most of the lifting starts after the first of the year, kind of getting ready for the new budget season.
Well, Lloyd, maybe the easiest thing to do is to cancel November and December and then have the January 28th meeting.
That sounds good.
Okay.
Fine with me.
All right, then Sarah, you don't have to send out a doodle poll. So what we've done is we've canceled July and we've canceled November and December, and we're going to have the January 28th meeting.
Okay, and I will have a new calendar invite to everyone now that we've decided on dates so that you will have them in your calendar.
Great. Thank you very much. I appreciate it. So that's good. That's done. And it's time for our service provider updates. So if you'll go back to Sarah, there you go. I like seeing the faces. So we'll start with, I guess we'll start with Kat. You're listed first. Garland.
Okay. Pull up, if I can, one thing here, if the host will let me. Give me the screen. I was going to show you our ridership numbers. Can everybody see my screen?
Not yet.
Okay.
Just see you.
Disabled. Okay, so what I was going to basically show, it's not letting me since the sharing feature is disabled right now.
I think Sarah would just have to give you permission to show.
I just did, so try it again.
Nope, still. Okay. Well, wasting time. So what I was going to basically highlight is our ridership numbers for the last quarter. April, our ridership was 29,355. May's numbers were 33,937. That fall off in May was an 87.7% drop in our ridership. Our June numbers, which I'll be able to pull at the end of the month, a few more days. Our ridership is probably going to be somewhere in the same range of 70 to 80% down, which is what's to be expected. Now, the hope is July, as we start going back into our phasing and we're starting to add a little bit more service, that we will start to see a little increase in our service, but it will not be back to the levels that we've seen before. Typically in a June or July month, we're at 140,000+ riders. I don't expect anywhere to be near that come this July. But we're also finalizing the final pieces to hire the consultant to bring them in to do a little technical work for us, to looking at all of our routes, getting the run times really looked at, honed in. We've got a request from the center to make a modification to one of our routes to have bus service to the center. We're working through that model still. July, August, and September will be our really active months with the consultant. And hopefully we'll be able to, in the fall, implement a new service model that is has more realistic running times, and we can see what happens there. We're also having conversations with UTS about potentially, because they're modifying some of their routes, where CAT could potentially add a little service to take a little weight off.
Oh, that's cool. That's great. I see Becca smiling. Okay, great. Brad?
I don't have as much of a robust update as Garland had, but we've mainly been focusing on that returning to normal operations, as normal can be, meaning just reoccupying our offices with our reservations and dispatch staff, and bringing back more drivers to start just rotating them through different shifts. And so working through those policies and procedures to make sure we're taking our responsible steps with prevention and such. That's mainly what's dominated our time. From a ridership standpoint, we're seeing that slight increase going on with our urban ridership. That's something that we're watching. I don't have numbers that I would share right now because we need a couple more weeks to see what that trend looks like. And I can report that back out to the localities, but we are seeing it tick back up from the low that it was at about 3 or 4 weeks ago. So we're gonna start reaching the expectation of that capacity that I identified, I believe, last time we met, that our capacity, essentially like school buses and others, are cut in half. So we'll start reaching that tipping point of demand versus capacity.
Okay. Becca, you're on.
Thank you. So last time we met, we clarified that right now we're just running that one route to get workers from a remote parking lot on grounds down to the hospital. The ramp up for ridership on that route has been slower than the hospital projected back a month ago. Thought that maybe by the end of July, that ridership would be back up to its normal daily ridership of about 2,000 riders. But we've only gone from 800 riders a day to 1,000 since our last meeting. So yes, it's ramping up, but I think it's a little flatter than the hospital projected. A couple of reasons, because the inpatient bed census is about the same as it was pre-COVID now. It's been built back up. But the outpatient, on-site outpatient visits have been declining, I think, because some of the telemedicine stuff has been really well received, and people are just as happy to, see their x-rays on Zoom than to come into the hospital. And so the outpatient counts are up and high, but the on-site demand is still being suppressed. So our other big news, of course, is planning for the students' return, which I'm sure everybody saw UVA's epically long release about all of that. And if you read through it or didn't, sort of the high levels are that there really is no declared return to work day for staff. It's going to be entirely up to the department whether people can continue to telework, and teleworking is going to be highly emphasized. So that commuter work trip will be highly impacted. The students will start trickling back onto grounds here in the next couple of weeks. Though just a few small student cohorts that are coming back, and then the resident staff that man the dorms, they'll be back around August 1st, and the students will start moving in on August the 15th. So by August 25th, when classes start, UTS will be back to full service, or what our new version of full service is going to be, because our entire service area is only 1.2 square miles, and because we have these epic crush loads on the buses of fully loaded 50 passengers a trip, we were faced with having to redesign our routes entirely to emphasize transit from the endpoints of our service area rather than the trips that are very, very, very short, much shorter than a typical transit distance between bus stops. We have so many that will board and just ride one stop. And so we cannot put that on the driver to have to manage to keep that loading to the limit that is safe. So we ended up proposing a redesign of all of our routes to emphasize that the shorter trips are going to be walking trips, and the longer trips will be where we're going to really invest our transit. And our longer trips are only, a mile. So, it's all very compact. We're a little delayed in I thought by this meeting I'd be able to say, and it's all been approved, and here's the maps. But UVA is a little it's a little bit slower than I thought it would be. So I really can't throw up a bunch of maps. Brad and Garland are aware of what's being proposed, and we're engaged in conversation about what those impacts may be on our connections to John Connect and CAT. But I really can't put up a map yet.
Right.
I'm hoping we got to know by the end of this week, or it's going to be hard to get everything ready in time to start running a vote. I don't know. Does anybody have any questions for me?
I just
Thank
have
you to
let she said yesterday in another meeting that I was attending that the university is finding that there are students who are making the decision to not come back, to take a year off, or to work from home.
Yes, so the deadline for students to make that declaration is July the 1st. And so there's going to be some little bit
Right.
better understanding of that. And then another milestone is in mid-July when all the class schedules will be out. And that's when people will know whether, is their class going to be online versus is their class going to be taught in person. And UVA, it's going to be very fluid.
Yeah. Okay.
But no matter what, we have these routes designed. We're going to be testing them over these next few weeks, and then staying in good touch with Brett and Garland and you guys. I can't thank you enough for receiving my crazy crayon drawings of these routes. Soon we'll be able to publish, and if we get a award or whatever you want to call it, approval to move ahead. If you don't mind, Sarah, I might send an update to you so that the RTP can be well informed as to where we're heading with it. But we know that we know there's an impact on those connections with Kat and John, and we're keeping those very much in the front of our mind.
Right. Thank you. Sarah, let's do rideshare, and then we'll jump back over to Jim.
Yeah, so rideshare is a quick update. We did receive approval from DRPT and the Commonwealth Transportation Board for the rollover of funds from the last quarter of FY20, which was something I mentioned in my update last month. And the CTB did meet to approve first quarter funding for the rideshare program. So we are have scheduled meetings with DRPT about how we will be moving forward in the budgets that we have been given, and what are the supported funding requests that we can make with those funds. So we are continuing to promote telework, and we are have our telework guide for all employers to help them look at formalizing, since as we've talked about a bit in this meeting, telework may be the new normal for many people. Making sure that employers have a firm and a solid telework plan that all of their employees are aware of and that they feel very comfortable with for having in a more long-term situation. So that's most of what rideshare activities have been.
Okay. Any comments or questions about? Oh, Jim, I'm sorry. I need to get to you. So schools.
Yeah, real brief. As I mentioned before, we're working out bell schedules, assuming 24 per bus. We completed an RFP for fuel. Lasts about I think it's 5 years. We looked at locking in a price now, but we can satisfy the monthly volume amount, but we can't do it on a per delivery because our tanks are too small. So anyway, we're going to just go with our RFP rack pricing. And then lastly, DMV is backed up, which impacts our drivers renewing their licenses and permit testing. So hopefully that starts freeing up a little bit, but right now you have to make an appointment, and they're really backlogged. So hopefully that doesn't hurt too much. You only have to go in to renew your license every few years. I think it's 5 years. So it's not a large volume, but the permit testing will hurt, because we're going to try to train our coaches to get their CDLs. So because we may not be able to provide athletic trip support, so they may have to drive their own bus. So to do that, though, they have to go in and get permit tests. So maybe you're running into some of that, Garland.
Yeah. Is it your understanding that if your CDL expired during this time, that you have till August 31st?
Yeah, August 31st, right? But now to get sometimes it's hard to get an appointment before then.
And we're seeing, because you have to go into DMV for the tests, almost 2 months.
Yeah.
Yeah, even renewal,
Yep.
just renewing your permit without the test.
That's correct.
Okay.
Yeah.
That's what we thought too.
Yeah. Okay. All right. And then I think, unless are there any questions for them? Any other questions? Then I think, Lloyd, you were going to give us an update on the CAT Advisory Board.
Yeah, council appointed a few members to the CAT Advisory Board. We did not have enough applicants to fill all of the slots available, so we will be having to re-advertise. Diantha, you had mentioned a couple of people perhaps from the county who would be good people to add in. And so the opportunity will arise again. We are normally our sort of workflow on these appointments is that we try to have one big batch of appointments quarterly. And so we had a batch of appointments in June, just a week or so ago. We appointed probably 25 people to different boards and commissions. And ordinarily they would not do another round of appointments until September. However, since we're having to re-advertise a planning commissioner, we may be able to re-advertise and reopen the CAT Advisory Board. And I know you had mentioned some names, and Carla, I think at some point you and I ought to talk a little bit more about how we're going to move forward with this. But yes, we want to get the CAT Advisory Board repopulated. I think it's fair to say that council as a whole was just sort of oblivious to the fact that we had to be doing something about that until I said something to them recently and said, this board of which I am the representative has never met during my time. I don't know when the last time was that it did meet. The only person who had ever expressed an interest in being on the board has now resigned from the board. We better get going. And so we're going to get going.
Well, and I would suggest B and Brad and those of us that live in the county, if we know people that would have an interest to be, because we want Albemarle County folks on that advisory board. So remember to think about it, and we could be submitting their names if they're interested to Lloyd to represent the county.
And once I know that we have officially reopened, I will get that word to you, and then I can send a copy, the link to the application that has to get filed and so on. But until it gets officially reopened, the link doesn't work.
Okay.
And I'd like to ask, Lloyd, would you be meeting once a month, and for approximately how long? That's usually what people ask.
I have no earthly idea.
Okay.
It's a quarterly.
Quarterly. Okay.
They asked for right now to be quarterly. That could change. I mean, you probably could do every other month, bi-monthly, which makes 6 meetings a year.
Okay.
I think that we long term, I know we're still trying to populate the advisory board, but I do think the structure of it probably does need to be a little more enhanced. We need some from the business community. I think it would be extremely helpful, at least 1 or 2, maybe the chamber, because I think what's missing is they need to be educated about how CAT works, because I can't really do anything unless there's a funding mechanism to do it, and the jurisdictions have to allow me to actually do the extension or change the routes, and then there has to be a pretty big, robust public participation process on the public side. So I think there's some frustration I've heard from some of the business members already about, CAT can't do X. Well, CAT can, but it's a matter of making sure we go through the process and then making sure everybody understands. I just can't take service out of one area that potentially has a high poverty rate and just move it because, you know, business wants it. So there's a lot of discussions that need to happen. And I think part of the role of this advisory committee could be to help educate that group.
Okay, thank you.
Well, I would suggest, and I agree completely. I think someone from the chamber itself should be, and I would love to see someone representing a minority business and a business in Albemarle County, perhaps. I'd like to get more than, you know, let's actually think big here because I think that's how transit is really going to move forward. And Becca, someone from the university, a student that's interested in transit would be great. I would think Lloyd on the advisory committee. So just saying, and maybe even Garland, it would seem like to me, and maybe Brad would feel differently, but when you're talking about referencing what your restrictions are, it might be that having a representative from Jaunt to speak to some of what they're able to do and some of the on-demand on the Citizens Advisory might actually be interesting too, because we are all one community and we're trying to move people around, and however best we can move people around is what works for our citizens. So just a thought. Yeah.
Yeah. So, I think then I'm not opposed to that, but I don't want to I don't want to muddy the waters. And I thought this is supposed to be a CAT advisory.
It is. It is.
Okay.
And I get what you're saying. I'm just thinking.
Yeah, I got you.
Yeah.
And I think part of making sure that we keep it clean is that the CAT advisory will be doing just that. It's the role of this group is to make a recommendation that we can bring forward to
And that makes sense. Yeah.
to city council or to the board of supervisors. My role is, I'm staff. I'm really helping to provide structure and guidance. But ultimately, the final two decision makers are city council and the board of supervisors, because you're the guys who can fund the product or make the changes. I can't do, I can, but I can only do it if you give me the funding to do so.
Right. Well, it would be great, Lloyd, and for being me, for us to be able to submit some names. So I guess what I'm hearing is that we could do that. Lloyd's saying that would be possible.
And if you all want to change the membership of CAT, you would just need to send that to council so that we can vote on it, so that the clerks can change it in the system when accepting the applications.
So like a representative from the chamber is what you're thinking, or a small.
Yeah, so if it starts changing, like
Yeah.
who's the makeup of this organization, then that needs to come to council for us to approve.
Yes.
Go to our staff.
Right. Because this is council's advisory. This is, their group. I'm staff to their group.
And I think the bylaws, or the last time I saw it, there was a place for an Albemarle County representation. I'm not sure that I saw any representation from the chamber or a business or a minority business or anything like that. I think it's
right.
Discussion, and Lloyd, maybe some thoughts, Nakaya. Yeah.
Of course, we can, even without formally changing the statute or the ordinance or whatever, council can sit there and say, we'd really like to have somebody from the chamber. Let's make sure that if a chamber person applies, we make them one of our candidates. So we can do it without changing those bylaws or changing the ordinance. But, so either way.
But I think it needs to be clear what the intention is if we are changing the makeup of the group, right?
Mm-hmm.
You're saying that we are now going in a different direction. That's a discussion that needs to be had, and that's very different from I was on somewhat on the CAT advisory before you, Lloyd, and there was even, the question of whether that advisory board was needed because that that existed before RTP? And was that needed in place of RTP? Was there a place for membership, on the RTP? Is that a committee? So those conversations were being had when I was sitting on just a couple meetings that I went to, because it was, again, it wasn't very structured. I had a time conflict. We were trying to change the time there, so there was a lot going on, and then there was membership, attempting to get membership for the board.
Well, according to the website, the CAT Advisory Board members will consist of no less than 7 CAT riders, shall be broadly representative of CAT ridership, at least 1 rider from the city of Charlottesville, 1 rider from Albemarle County, 1 rider from UVA, may request representation by agencies the board deems relevant to public transit, and the purpose is to advise council, recommend to council policies regarding the services to be provided and the appropriate procedure for implementing CAT plans. So on the one hand, Nakia, you've been on the board at least a little bit. I haven't been at all. All I know is what I get when I take a look at this website. But it's pretty vague, it seems to me.
Hi, Julie.
How are you?
Anyway, we'll deal with it.
Well, I don't want to take up a whole lot of our time because it is your all's CAT advisory board. It does sound like we could send in some names for Albemarle County, a
Absolutely.
representative of the county, and the city could determine that the chamber would be one of those organizations if you chose to, or a minority business, or so. We'll just ask for an update as we go through, and in the meantime, for some of us in Albemarle County, will see if we can find a name for a representative from Albemarle.
Thank you.
Okay. All right. And with that, DRPT technical assistance schedule, who's doing this one? Is that Neil or Chip?
I can.
Chip. Okay.
I can probably just let you know. Very similar to the other grants from DRPT that's needed for the Afton Express. We have sent in both applications for the technical assistance grants. And as Neil said, we're expecting sometime in the fall rather than the summertime, hearing whether we're awarded or not. That's both the technical assistance grant for Albemarle County and then the regional visioning plan.
I'm just pleased. I know everybody's happy that we managed to get those grants applications in and our money sorted out for our matching funds. Yep. Yep. All right, regional visioning and Albemarle expansion studies you've already covered. So I am open to, is there anything anybody else wanted to ask or discuss? We're running a little early, but usually you all don't have a problem if we adjourn a little early. So, but I'm open to anything anybody else wants to add. Okay, we'll see.
Madam Chair, if I could just remind you, it came to my mind, we were talking about the schedules and somebody said that they could get notes from someone. I just want to remind everyone that according to the Freedom of Information Act, with the new emergency public meetings, these are being recorded and they are on the website within 10 days after the meeting. So, if you want to go back and revisit or share with somebody, the information is there for you.
Mm-hmm. On the TJPDC website. That's right. Mm-hmm. Great. All right. Well, with that, then we decided we were not going to have a July meeting. So I'm going to adjourn us then to August the 27th. And I believe an agenda item, as long as it still works for Jaunt, will be the Jaunt on-demand pilots and what that might look like for Albemarle County. So with that, stay safe and thank you for joining us. Bye-bye, guys.
Everybody.
Thanks.